I'm Will with Strategic Retirement Solutions, and thank you so much for joining me this week. This week, I want to talk about Medicare because getting this wrong is one of the most expensive mistakes I see people make in retirement. Start with the enrollment window. You get 7 months total, 3 months before your 65th birthday, the month itself, and then the 3 months after. You miss that window without qualifying coverage elsewhere, and you're looking at a late enrollment penalty that follows you for life. It's added to your premium every single month permanently. Not a one-time fee, but forever. Here's where it gets tricky. A lot of people assume that if they're working and their employer coverage is through a spouse, they're automatically fine to delay Medicare. And sometimes that's true, but the coordination rules depend on things like the size of your employer and whether the coverage counts as actually being creditable. I've seen people assume that they were covered, then they delay enrolling, and they find out the hard way that they weren't actually covered. So it's worth checking on directly and not actually just assuming. The third mistake is choosing between Medicare Advantage and original Medicare with a supplement without really thinking through how you personally use healthcare. Advantage plans may offer lower premiums, which can be appealing, but if you travel frequently or manage chronic conditions, Medigap paired with the original Medicare can tend to give you a little more flexibility. There's providers nationwide, less network restriction. And so if you get this choice wrong, it can potentially cost you thousands of out-of-pocket medical expenses down the line. So what should you actually do? Here's 4 things. First, understand all 4 parts of Medicare. A is for hospital, B for medical, C, which is Advantage, and D for prescription drugs. You need to know what each one covers before you can make a good decision. Second, if you travel a lot and have ongoing health needs, seriously weigh Medigap and original Medicare over Advantage. Third, and this is the piece that people often skip, build healthcare costs into your actual retirement income plan from day one. Premiums, out-of-pocket maximums, dental, vision. These aren't small numbers, and they need to be part of your projections, not just an afterthought. And finally, review your coverage every single year during open enrollment. Your health changes, and so do the plans. What worked 3 years ago may not be your best option today. The bottom line, Medicare decisions made in your early 60s can either save you or cost you tens of thousands of dollars over the course of your retirement. This is exactly the kind of thing worth talking through well before you turn 65. And if you want to learn more about retirement topics just like this, I encourage you to go to retirementprotected.com, where you can watch my free educational webinar to dive deeper and help you avoid making these mistakes in retirement. Again, that's retirementprotected.com. Thanks so much for joining me this week.